Bismillahirrahmanirrahim. I'm Dr. Javed Iqbal Kokar, Professor of Forensic Medicine. As we're discussing traumatology, and this is the third lecture. And contents of today's talk will be that I'll be discussing what are the injuries which are caused by the blunt forces or the blunt objects and the blunt weapons. And they are basically the abrasions, the contusion or the bruises, and the lacerated wounds. And today I will discuss abrasions and what are various definitions, what are various types, and what are the mechanics involved in the causation of the abrasions. And what is the cause and effect relationship, how they produce different types like moving abrasion, the friction abrasion, and the imprint abrasion. Then the medico-legal aspects, which are the determining the time, the age, how old the injury is, the manner of infliction, and the complications. So starting with the topic, the injuries caused by the blunt forces, the blunt objects or the blunt weapons. And they are the abrasions, the contusions or the bruises and the lacerated wounds. So starting with the abrasions, abrasion is basically an injury which is the caused by blunt weapon, and it is the most superficial injury. The mechanical injury characterized by the damage to the most superficial layers of the skin, and it is caused by rubbing, indenting, that is the pressure, or scraping, and it causes irregular removal of the epidermis. So it's a mechanical injury characterized by the damage to the most superficial layers of the skin caused by rubbing, indenting, scraping, causing irregular removal of the epidermis. And what is the cause and effect relationship? Cause is the blunt force and effect is the injury. So how they produce, this is the damage to the most superficial layer of the skin, that is the effect. And what is the cause? The mechanics may be the friction of the rough object moving against the skin. So that is the cause. So the cause is the friction of a rough object against the skin, and the damage is the most superficial layer of the skin. So this is the simplest of all wounds, and when it heals, it leaves no scar. Initially, the damaged surface is covered by exudates of the blood and the lymph. It soon dries up, and on the surface it forms scabs. And it hardens between 12 to 24 hours, that is called crust. And the crust contains dried up blood, lymph, and injured epithelial cells. Now, classification of the abrasions or the types, they are moving abrasion or friction abrasion and imprint abrasion. So the name itself is telling us the mechanics: moving, friction, and imprint. So the moving abrasion, it is either the scratch or a graze. So types of moving abrasion, they can be scratch or a graze. It gives evidence of direction of the piling up of the epidermis. That is, when we move any object, causing moving abrasion towards the direction of the movement of the blunt object, there will be piling up of the epidermis cell. It will tell us the direction of force applied. So this is the pictorial diagram showing the pressure and the movement, and you can see the piling of the epidermis towards the movement of the blunt object. Then the scratch. Scratch is basically a single pointed tip. It is caused by narrow and sharp pointed object, which can be a fingernail, a pin, or a thorn, which when run across the skin. So a sharp pointed object, single sharp pointed object, a fingernail, a pin or thorn, when it is dragged or it runs across the skin, it causes scratch. And when such objects are rubbed, they carry epithelium in front of them, and that's how they tell the direction of the force applied. So the direction of the scratch, it can easily be judged by the piling up the skin towards the direction of the force. So the sharp edge of the scratch shows the initial point of impact, and the terminal point is where the epithelium has piled up. Now the multiple scratch. When a single pointed object has been applied multiple times, it will show multiple scratch. So you can see these are multiple scratches. So these usually appear in blows, falls, roadside accident, nail scratching, teeth bites, and dragging. Abrasions are in the form of furrows, and they are broad at one end and they tail away on the other end. This tailing shows the direction of the movement or the injury. Now the graze. Graze are basically injuries when the broad surface of the body is rubbed, and this is how it appears. This is produced when the body is dragged on the rough and broad surface. So the broad surface of body is rubbed on the rough surface, and then a graze can be seen. So this particularly happens in road traffic accidents. At the commencement of injury, it is clean, but at the terminal end, it shows serrated borders due to piling up of the epithelium. It indicates the direction of the injury, and when we reconstruct the scene of crime, we can easily judge which is the direction of the force. Now the friction abrasion. The mechanics itself is telling that friction is applied. So it is produced by linear pressure over the skin and soft tissues along with movement. That is pressure and movement. Pressure and movement. So that is the mechanics of moving abrasion, friction abrasion. So this causes friction to the extent that it can produce a heat of second degree burn. So much heat is produced by rubbing the object, pressurizing and rubbing with movement. Second degree burn can appear there. And it can be like tying up of the rope in hanging or strangulation, or tying up the arms. You can see the marks of the rope, and there is mark of the rope. Then the imprint abrasion or the pattern abrasion. That is imprinting, or pattern is imprint at the site of infliction. So the pattern of the weapon is imprinted, and this impression is stamped on the surface, on the skin. And the pattern of the object is stamped. They can be a tire mark, there can be radiator grill marks, so they will be imprinted there. Teeth bites or the rough stick imprints. So you can see the tire marks and you can see the radiator grills. These are the pictures. Then regarding the medico-legal aspects of the abrasions, we have to determine the time of the injury, how old it is, the age of the injury, and then it is antemortem or postmortem, then the direction or the nature of the force applied, and the manner of infliction. So these are the medico-legal aspects. Then the complications, pathophysiological effects, are the complications of the abrasions. So regarding the age of the abrasion, the fresh abrasion is red in color, and in 12 to 24 hours a reddish scab is formed, and due to exudation of serum and protein, that scab is formed, which is dried up blood, lymph, and the epithelial cells, and it would appear as brownish scab. In 2 to 3 days, it turns dark brown and dry and adherent. These are how the abrasions appear on drying up and the brownish scab formation. Then in 4 to 7 days, there is primary healing. You can see the sloughing of the scab, and in no granulation tissue will be left. And in 15 days, the abrasion will completely disappear, leaving there is either no mark or very less mark, which will fade away with the passage of time. Now regarding the age, again repetition, that is fresh is bright red in color, scab formation in 24 hours, reddish brown in 2 to 3 days, and shedding of the scab and reepithelialization in 1 week, and complete healing in 2 weeks. Then regarding the antemortem and the postmortem nature, that is it. If the injury is on the dead body, we have to determine that it was inflicted before death or it is an postmortem injury. So we have to distinct it. It will be from the color, from the margins, and from the vital reaction. So the antemortem abrasion, they are blurred and hyperemic, showing the vital reaction. And the postmortem, they are sharply demarcated. The antemortem will be showing the vital reaction, whereas the postmortem, no vital reaction will be seen. In antemortem, the repair, healing, they are the antemortem phenomena. They will be seen. And dried up epithelium as parchment-like, whereas the postmortem, no signs of healing or repair will be seen. Then regarding the manner of infliction, it is accidental or homicidal. Most commonly it is accidental or homicidal. Examination of injury, circumstantial evidence, they will help us in recognizing the manner of infliction. So less commonly they are self-inflicted, but they can be easily recognized. Regarding the direction and the nature of force applied, the pattern of imprint, we can predict that it is a rope, it is a wire, or any material. And the direction of the piling up of the epidermis will tell us the direction of the force applied. So regarding the complications or the pathophysiological effects, it can be infections, it can be shock, but infections can be rare, but sometimes due to removal of the skin, it provides invasion of the bacteria, and particularly they are gram-negative. And the shock, it is unusual but massive abrasions with other injuries like contusion involving more than 25% of the body surface area can cause shock. Because there is loss of serum, proteins, electrolytes, and that will be the reduction in the circulatory volume appearing as shock. So thank you very much. This is all about abrasion. We'll continue the topic of the traumatology in the next lecture. Take care. Allah Hafiz.